So it's more than spikes. There's a lot you can get out of ECG, and I'm sure you will improve your knowledge today. So a few basics. I'm not going into too much details. There's a sinus node on the atrium which originates, that's where the normal ECG originates. Although every part of the heart is capable of generating ECG, but it starts from sinus node in most cases, travels down to AV node, which controls your heart rate. So if this is your battery, this is your toll plaza, it controls how much electrical activity needs to go into the ventricle. And then you have Purkinje fibers or bundle of branch. Sorry. So there are some normal aspects of ECG. You all need to understand there's a P wave, which is atrial contraction, followed by a QRS, okay, a QRS, and then an ST segment turning into a T wave. So P, QRS, ST, and T. I'm sure you all know this, but remember the paper speed should be 25 millimeters per second. That's the speed across this axis, and the voltage will be 10 millimeter per millivolt, which means these two squares is 10 millimeters is 1 millivolt. This is more important. Why? Because 5 squares equals 1 second if you set up the paper speed at 25 millimeters per second. If this is set up wrongly, your heart rate calculation can be wrong. So certain normal parameters that you need to be aware of. First thing, PR interval, which is from the start of the P to the start of the R wave. That should be 5 squares or less than 5 squares. So 5 squares is about 200 milliseconds, because each small square, sorry, there's some noise in the background, if you can stay mute. So one small square is 0.2 of a second. Each small square is 400 milliseconds. So 5 of these, 1, 2, 3, 4, 5 is 1 second. Okay, so 1 is 0.2 second or 200 milliseconds. So PR interval should be one big square, just to remember. QRS duration, which is from the start of the Q to the end of the S, it should be within 3 small squares. Okay, so 3 small squares is about 120 milliseconds. Here it says less than 110, but even up to 120 is acceptable. And then QT interval. Now QT will come to later, but just remember for females it's a bigger number, 0.46 seconds or 460 milliseconds. For males it's 440. That's the normal range. I'll discuss QT later. This is an important slide for 2 reasons. One, because all of you should be aware of how to do an ECG in case you have to do it yourself. So you need to know where to attach the chest leads, which are leads V1 to V6. V1 comes on the right side of the sternum in the 4th intercostal space. V2 comes on the left side of the sternum in the 4th intercostal space. Okay, so that's easy to apply. Then make an imaginary mid-clavicular line. On the 5th intercostal space is V4. Between V2, V4 is V3. And then anterior axillary line and mid axillary line, same 5th intercostal space, V5, V6. Why is that important? It's important because if you see there's a heart sitting behind the sternum, which is more towards the left than you can see in this picture. This V1 is looking at the heart from this angle. This V2 is looking at the heart from this angle. So it's looking at the front of the heart. Remember that. V1, V2 looking at the front of the heart, which is often the anterior heart and sometimes also the right ventricle. And then as you move from V3, V4, V5, V6, it's looking from the left side of the heart, okay, or the apex of the heart. So this three-dimensional aspect is very important. Imagine something looking from here, something looking from here. We'll look at the same thing, but in a different way. So imagine if there's a car parked here. One guy is standing here. He will look at the front of the car, but this guy will be looking at the side of the car. So that's how ECG leads look different from each other. If ECG leads are put in the wrong place, let's say these are moved up here or up here, imagine the the reference point will change. And when the reference point changes, you will be looking at the heart from a different angle. And by looking at the heart from a different angle, obviously your axis will be wrong. Your T waves might become inverted for no reason. So that's where, some misdiagnosis comes in by putting the ECGs in the wrong place. These were the chest leads. Now we're talking about the limb leads. So you have AVR, as the name suggests, on the right arm, AVL on the left arm, AVF on the feet or the legs. So obviously this is looking at the heart from the bottom end. This is looking from the left side. This is looking from the right side. And then you have leads 1, 2, and 3. So 2 and 3 looking from the bottom end, okay, and 1 is on the left side. It's important because if you don't put them in the right place, you start seeing things which you are not meant to be seeing, or you miss out things which you should be seeing. So let's, with that basics, let's just move to some ECG examples, because that's what you will enjoy more. Can you confirm that when I'm moving my cursor, are you all able to see my cursor moving? Can you confirm that?
Yes.
Okay, thank you.
Yes.
Thank you.
Yes.
Okay, so first ECG. Now, stay mute, all of you, please. Yeah. So the purpose of this ECG, it already tells you on the top it's a normal ECG. But I want to take you through a scheme of how you should report it. So whenever you've given an ECG and you're not sure what to do, what it's showing, remember a few basic things. First thing, actually, I'm going to ask you people, one by one, just unmute yourself and tell me what are the things you need to mention when you're reporting an ECG. So what's the first thing you want to check?
Rate.
Rate. Okay, someone said rate. Something else? Someone else should tell me something.
Rhythm.
Okay, rhythm.
Axis.
Axis. What else?
Regularity.
Regularity. Regularity.
ECG settings and label.
Good. Yeah, make sure it's properly labeled as the right patient. Yeah. What else?
Interval.
Intervals. Yeah. So PR intervals, QT intervals.
Whether it's sinus or not.
Yeah. So that's rhythm. Yeah. Anything else? So these are the basic things, and then you will look at T waves. Yeah. Make sure they're upright where they're meant to be. You look at QRS complexes. You will look at ST segments. Okay. The other thing. Okay, let me take you through this. So the first thing here, let's assume it's the right patient, the right label. Okay, that's a good point. Make sure the calibration is correct, but let's assume for the rest of the talk, all calibrations are correct. Okay. First thing you want to check is whether it's sinus or not. And how do you tell if it's sinus? P wave. Okay, so presence of P wave means it's a sinus rhythm. So this is P, QRS, T. So presence of P wave means it's sinus. Next thing you want to know what's the heart rate. Who would like to tell me how to calculate a heart rate on ECG?
The number of boxes divided by 300.
Number of boxes divided by 300. It's the other way around. 300 divided by number of boxes. Yeah. Okay. So let's take a R wave which falls on the red line. Count the boxes to the next red line. And luckily, it's very clear here. So 1, 2, 3, 4, 5. 5 squares. So 300 divided by 5 is 60. The heart rate is 60. And the reason for that is 5 squares is 1 second. So if every QRS complex is coming after 1 second, the heart rate will be 160. It slightly varies here, you can see, but then it goes back to 60. Okay, slightly longer than 60, but then it comes back to 60. A sinus arrhythmia, slight irregularity. Okay, but overall the heart rate is regular. Heart rate is 60. Do you all understand how I've calculated the heart rate? So if the next QRS complex was here, the heart rate will be 300. If the next one will be here, it will be 300 divided by 2, 150. If it was here, it will be 300 divided by 3, 100. If it was here, it will be 75, 60, 50, 40 something, yeah, and so on. So heart rate we've done, sinus we discovered, regular it is. Next, do you say axis? Now, I am going to explain axis in a bit more detail, but here I can tell you very quickly, axis is normal. For the axis, you want to look at lead 1 and lead 2 in AVF. And if all of them are positive, it's normal axis. That's just a simple thing for now, but I'm going to come in next few slides and have a detailed discussion on how to look at axis, because a lot of people get confused about axis. Okay. Next thing, PR interval is within the square, so that's normal. Let's look at the QRS duration then. I want all of you to focus on QRS durations. It's less than 3 squares, so that's normal. Okay, so it's narrow QRS. One other thing you all should keep an eye on as we go through this is look at the QRS in V1. Look at V2, V3, V4. So it's negative here. Negative means it's more downwards. V2 is more downwards. V3 is more downwards. V4